The Companion Animal Teaching Clinic really has two main goals: to teach veterinary students really intentional skills around practicing what we call a spectrum of care in veterinary medicine. That concept that once you are out kind of in the real world, you need to be able to be flexible in your treatment plans, have multiple options for families. The other thing that we're doing here is giving students really a taste of what it's like to be an associate veterinarian in a busy general practice.
The goal is to really have this be a student-led clinic, that they can get those hands-on skills of having to be the doctor in the room and having them be practice-ready veterinarians as they finish up their fourth year.
The Companion Animal Teaching Clinic really helped to prepare me for my future as a small animal practitioner by letting me learn to run appointments all by myself from start to finish. It's not just like a question-answer environment. It's more of like they teach you how to think and how to be creative, and how to know that there's multiple right answers, and they're always encouraging you along the way.
It's giving them the confidence to be a doctor, allowing them to actually be in charge of the cases. Everything they learn here will allow them to go ahead and incorporate that into their next level practice.
We are investing heavily in our future veterinarians and giving them a chance to really get some hands-on experience. When they go to a private practice and they're asked to do something, they'll be able to say, okay, I've already done that, and I feel comfortable with it.
The CATC has been really special and important to me because it allowed me to really grow as an independent future veterinarian while having the support of my classmates and the attending doctors, so I was able to go out of my comfort zone while still feeling fully supported.
This clinic really prepares students to be confident and proactive in helping develop what the future of veterinary medicine in Minnesota is going to look like.